Welcome, everyone. Hope everybody is doing well today. And we are finally going to start summer and spring soon, and we'll see how the weather goes. It's rainy and cold today in the Twin Cities. So again, thank you all so much for joining us today for the MBQIP open call for the Minnesota Critical Access Hospitals. So on the today calls, what we want to do is continue our discussion from the Minnesota CAHs survey results, but this time around focus more around the QI activities that hospitals reported working on. And then we really want to open up the space up for you to share what you're working on and how those QI activities are going. So last time the call was a bit more didactic. It was the staff talking about data submission, reporting the reports, MBQIP reports, how to access those. And then we didn't really have much chance to talk more as a group and have more of a discussion around the QI activities that are going on. And I think there is a lot of exciting work that's happening across all of our 77 critical access hospitals. And I think this would be a really great time for all of you to share what you're working on. We also want to recognize our Minnesota quality improvement mentors we have 3 Minnesota mentors who are participating in the national program. So we will be inviting them as well to just briefly talk about, share what they're working on as part of that program. And then Robin has data abstraction trainings coming up in June. So we will talk about that. And then we'll also do some follow-ups from the March 30th call around data submission on May 16th. So OP data and healthcare influenza data was due on May 16th. So we want to talk, how that went. Did you have any issues? We also want to talk about accessing the MBQIP data reports. So last time, Robin demoed how to get to those, and again, want to follow up to see if you've been able to get to your reports and if you have any questions. And then again, as we said, we really want to make this an open call, truly an open call today for you, again, to share what you're working on, how things are going, what have you discovered, what are some lessons learned, what are the best practices, are there some tools, resources that you have used and have found really helpful and would like others to know as well about those. And then also open up the space for you to ask, again, questions about data reporting, submissions, MBQIP reports, any issues, concerns, questions around those. So reminder about the team. So the whole team is here today. So always good to be together with you, all of you. So let's start with the recognition of our Minnesota Critical Access Hospital Quality Improvement Mentors. So they are serving as as part of the National Virtual Quality Improvement Mentors Program for the Medicare Beneficiary Quality Improvement Project that's part of the FLEX program. So the Minnesota mentors are Karen Bommersback from Cars Health Redwood Hospital, Marilyn Deno from Community Memorial Hospital from Cloquet, Minnesota, and Tammy Sushi from Tri-County Hospital in Medina. So really just, this is, amazing that we here in Minnesota, we have mentors who are imparting their knowledge nationally. They're participating with other hospitals, mentoring them, imparting their knowledge, giving advice. Their thoughts also appear in the MBQIP monthly newsletter. So it's really amazing that we have this resource here in Minnesota. So at this time, I would like to invite, I think I saw both Karen and Tammy were on. If both of you or one of you would like to share, how, what you're working on as part of this program. What are you learning? What are others learning? Just anything that you would like to briefly share with the group.
Seneca, this is Tammy, and thank you for allowing us the time to talk about it. I have to tell you, what I am the most excited about is that I get to learn from people not only in Minnesota, but outside of Minnesota. It's a great group of very smart people and it's just fun to learn more. I mean, just because we're mentors doesn't mean we aren't going to continue learning. And it's fun to share ideas. And really that's what appealed to me initially when I was asked about it. So we're really building off what the quality mentors from the previous cycle started building. So we started out with talking about what performance improvement, what does a successful project or experience look like, and what are the ingredients you need for that? So that was already, and we call it pie. So what's your favorite pie recipe? So it's been fun to see the foundation on and building on that. And on our last meeting, we were talking about how can we really use and showcase storytelling as part of our performance improvement projects. And it's something I think that a lot of people are very passionate about. And when you have your patient story in front of you and you're building off of that, that really creates a lot of momentum and energy all of its own. And it's great to be able to take an experience that someone has had, good or bad, and build on that and learn from it and keep improving the care we're providing to our communities.
You know, you're giving us ideas over here, Tammy. So next time we might have you come back and tell us more about how to use the storytelling. So it's such an interesting concept. It really sounds very interesting.
Yeah, and I really, Karen, if you have anything to add, that was really a pretty high level glimpse into some of the work we're working on.
I do, and I have to echo, Tammy, what you said, just the collaboration of not only the mentors and our specific group, but the previous mentors too, and the resources that they have developed. As we work towards standardization across our system with our particular facilities, it's really highlighting and showcasing those high-performing agencies and learning from them and expanding that knowledge across our system. And being a resource to others. You know, it's nice to know that just because what we do in Minnesota, you know, can be, you know, replicated in other states, and what other states might be working on in facilities there, we can bring those portions back to our own hometown too. So it's been a very nice group.
Perfect. Is Marilyn on? I don't think I saw Marilyn. Okay.
Could I just add, this is Robin, could I just add a little quick, I just want people to understand how, I know the slide says that, you know, these guys were nominated, but it was, you know, a combination of Stratus Health talking with Emma Distel, the Flex coordinator, and, you know, how, you know, we've known Tammy and Marilyn and Karen for a long time and know the good work that they do. So, you know, spoke with Emma and Emma put their names into nomination to the Rural Quality Improvement Technical Assistance Team, the Arquita team. And then they kind of had a chat with everybody and with all of the nominees from, you know, across the country, and decided that the three that, you know, we had nominated from Minnesota were, you know, really strong QI individuals and wanted them to be a part of this mentorship. So just so everybody knows that, you know, this could be any one of you that might be nominated. You know, if like you let us know what's going on in your hospital with quality and, you know, really have an interest, next time this comes up, you know, maybe you'll get a chance to be nominated. So I just want everybody to know, you know, the potential is there for all of you.
Yes, absolutely. And I would also say to Karen, Marilyn, and Tammy, as you are working on this, I think it will be, you know, coming back to us too as a group, and you will be such a great resource. We'll be tapping into you to kind of hear what are, you know, others doing in other states, and what are you learning from that? What are you learning from us? How are they using what we are doing? So such really interesting concepts like storytelling and standardization. So we'll be tapping into you some more for our future calls. But again, most of all, thank you. Thank you for doing this and for being part of this program and for, you know, imparting your knowledge from Minnesota and learning from others. And again, as Robin said, the potential is here for everybody to be mentors in the future as well. All right, so moving on, data abstraction trainings. So Robin is going to do 3 sessions in June. The first session is coming up on June 8th, EDTC abstraction and submission. So Jody will be sending, she has already sent 1 email with the registration link, and many of you have registered, but she will be also sending a reminder email next week for all of the sessions. And then session 2 is coming up on June 22nd. It's for outpatient measure abstraction, again with Robin. And then session 3, card and data submission on June 29th. So this is really for anybody who would like a refresher, or especially if you have new staff that's doing data abstraction and you would like them to get training, this would be a really great opportunity for that. I will also say that Patrick Merrigan from MHA will be participating on the EDTC training, and he will demonstrate how EDTC data is submitted to the portal, and he will talk about that piece. So that was really great that he was able, that's really great that he's able to join us on June 8th. Robin or Jody, do you have anything you wanted to add about this?
I don't.
Okay. So again, Jody will be sending a reminder email with the registration links if you have not registered yet. So that will be going out next week. And then follow-ups from March 30th call. So we spent some time talking about the data submission for the OP22 and healthcare influenza immunization measures. So those data were due on May 16th. Robin also demonstrated the, she talked about the NHSN, CDC, HSNN system and how to get into that and submit data. So just wanting to follow up to see if anybody had any issues, problems. Was it easy to get in and submit the data, or was it still a struggle, or, you know, were there any challenges?
This is Karen, and I have to say for our facilities, we didn't have any challenges. It was the constant emails from the, I think it was HQS or HQR, saying that one of our IPF facilities didn't have their information in. And I think it was a miscommunication between the NHSN site and the email distribution. So we had it all verified and confirmed and met the submission requirements, but kept getting the emails that we didn't have our information in. So.
Did anybody else have that same issue? You're putting that down on our list to look into and see if there's anything.
Well, the situation is they wouldn't send out information probably to a critical access hospital because that information is optional. So it might have been that it was the PPS hospital, Karen, that they were referring to.
No, it wasn't.
Something to follow up on and see if they're doing now that for all of the hospitals, it might be what they've changed. So we'll take a look. Anything else? So, you know, anything else that anybody would want to share, ask? So the other piece we are working on is we are now looking more closely at who is submitting the data consistently, regularly on the schedule, and who is not. And so one of the goals of the MBQIP project is to improve data reporting for the core MBQIP measures. So to kind of get to that, we are going to be more intentional, reaching out to those who have not submitted their data and kind of checking in and seeing, okay, what's going on, why no data submission, trying to problem solve together, figure out what's going on, how to get over the issue, again, and understand what's happening. So we can be more helpful to you in that way, so you can get the data submitted. And I would also add that like the data training, it is the data abstraction training. It's also, it's part of that. We didn't do any last year, and it was really time to do a refresher, but it's also to kind of get us back into that data reporting mode. Okay, now we gotta keep reporting data, and so we will be, again, just more intentional. So Robin is going to be doing more of that one-on-one TA reach outs. And she has already done some. I would just want to know that since March 30th, she has already emailed or talked with some of you, but that will continue as we continue with the project. So the other item we talked about on the last call was downloading, viewing the MBQIP data reports via the Sharefile. So Jody sends out the notice that the data reports are available. And she and Robin demonstrated last time how to access Sharefile reports. And we did notice an uptick after the last call that some of you did go in after the call and looked at your data reports. Again, any questions, are people, doing that now, or is it still kind of, I know some of you have said that you have your own reports and that's what you look at, and some of these are also lagging 3 months. So again, just kind of checking in how is this going? Okay, yeah, somebody said no problems in accessing the reports. Yeah, this is the other piece. We want to, have people kind of view those reports. Again, if you already have internal reports and they're working out well for you, that's great, and you're using that data. But if you don't have ability to view the data internally and you are waiting for these reports, these are really a great option to wait for and be able to look at the data, and these can then help you identify what are some area of improvement to work on based on the data.
And just a reminder that you need to look at these reports, because this is the way that you know that your data is getting to the warehouse. Okay. We need, I don't have access to data before looking at these reports. So we don't know if your data is there until we see these reports. So we want to make sure that the reports are accurately showing that your data is getting to CMS or getting to NHSN.
So somebody said that she had trouble finding her reports. Is it, Sarah, are you able to unmute yourself and just kind of say more about that? Is it you get in, but the data is not there, or?
I get in, but I'm not sure where I'm looking. I can find like all the other data, but I cannot find the EDTC report specifically. And I'm not sure if I'm looking in the wrong place for it or what.
Okay.
So Sarah, are you going into the portal from the email that I send you with the link?
Yes, I was.
Okay. We can work with this offline. I'll go in right now and make sure they're there, and then we can chat.
Thank you.
Yep.
Okay, so now looking more at the QI aspect of the report. So really, as Robin said, the reports are a good way to find out if the data had gone through or not. The other way too is looking at these reports to find, to look at the data, see what the data are looking like, and see if there are some areas of improvement that can be identified from those data reports. So on the survey, we asked the question how people are using data reports to focus their QI efforts. And, people said yes. There are 22 hospitals who said yes, they use the data reports for that. And then 7 said no. And then those who do use the QI reports the MBQIP reports to focus on QI efforts, they said they use it for benchmarking, setting the goals, process improvement ideas, part of data review practices, looking at their EDTC scores, star ratings, and then looking at the specific reports that they need, like the ED throughput and door-to-door doc times. And then others said, the 7 who said no, they have reports internally already, or they're just looking at other data, or it's just a quality report overload. So I will invite you to talk more about that. But before we get to that, I have one more slide before we get to the discussion part. So EDTC was the most popular choice as far as the QI activity, and then the ED throughput, OP18 measure, and then antibiotic stewardship was in the top 3, and then AMI and HCAHs and the others. And then there were some other activities that people reported, HCAHs, which shows up on the graph, but it showed up a lot in the comments too. It could be in conjunction with some of the other major ones on the graph that people are working on. And then sepsis, skin integrity, restraint use and documentation, stroke and trauma PI measures, and then early mortality. So I would just note, aside from HCAHs, the other measures are part of the more of the additional MBQIP measures, which is also good to work on. But what we are really trying to push right now is more of on the core MBQIP measures. Again, it's great to be working on the additional ones as well, but we also want to make some change first on the core measures. So then, as far as how these activities are going, so a lot of people kind of had to put some of these activities on hold, like the influenza vaccination ones, or OP18, OP22 were challenged because people were being boarded in the ED for a long time, or had challenges transferring patients just due to COVID. HCAHs, again, is always part of the focus, mainly in conjunction with other main work that people are working on. And, the hospitals really want that CMS 5-star patient satisfaction rating. So HCAHs is always one of the top activities. People are working across departments to coordinate activities and to report data for the measures. So different departments need to report different data. So there's a lot of that going on. Using, again, to identify outliers, finding opportunities so they can then do more education for staff, depending on the measure, some EMR improvements, and looking how that's going to affect the EDTC measure. And then just somebody said that participating in MBQIP brings an awareness of areas to improve on and realistic goals and standards to meet or maintain. So again, that goes back to, how can we use this program and the data to kind of help identify what those areas of opportunities are. So now this is the open discussion time. So this is really the main goal for the call today, is really to invite you to say a few words. How are your QI activities going? What's working, what's not working, what are some lessons that you've learned, what are the challenges? Some stories, stories of success, that's always a big one, and then are there any tools, resources that you have found and used that have been really helpful to you? And then, we'll also use the time to ask any questions about data, measures, anything else that's on your mind. So again, it's all in the relation to the survey. Again, how are you using the reports and kind of what are the activities that are the top priority for your hospital and how things are going. Would anybody like to start us off?
Well, this is Tammy. I can start talking about a huge initiative we undertook here, and you know, we opened and started some focus on it in 2019, late 2019, and of course we all know the big worldwide event that occurred, and so like everybody else, we keep finding projects that we started and never got back to. But this is one that is pretty important. So we do focus, you know, we've done some work around the ED transfer communication, and we're seeing our numbers move there. And that was really about re-educating staff and reminding them of the importance of all that documentation. But something that we're heavily focused on are our mental health patients. And we all know that's a national issue. You know, frequently they're in our emergency rooms for many days. And what we noticed when we stepped back and looked at individual occurrences that were occurring and tying that all together to our whole care process is internally, we didn't have a lot of consistent processes with all the staff. So we're doing a large improvement project here at the hospital. Here we call them TCAT projects that we stole years ago from TCAB, which is Transforming Care at the Bedside, but we just call it Transforming Care at Tri-County. And this is our biggest project since COVID has gone away. Well, it hasn't gone away. I would like to rephrase that statement because we know it'll never go away, but we have closed incident command. So now I have more time and energy to devote to these things. And we did our big value stream mapping process, and we're very excited about the momentum. We're working with our providers and our nursing teams, our social services. And once we have consistent internal processes, we will be inviting our external partners into the process and redoing a value stream map that will include them so we can all be on the same page and know what each other's expectations are. So when we call any of the 3 or 4 counties we typically work with in a situation where we need their help, that we're all talking the same language and expecting the same outcomes as far as what we're doing for each other. We all want the best outcome for the patient, of course, but how do we get there? And it seems to be different internally. And then next we want it to find out how we can make it the same externally. So we're all sort of on the same page.
And Tammy, how did you say the project came about? Was it, you know, you just had a lot of, you know, the issues, the data, or, you know, how did
Yeah,
you?
so of course everybody's length of stay for mental health patients is very long. That is the measure we're using. But also, so one patient coming in on day A may get treated somewhat differently than the patient coming in on day B, right? So how do we get consistency in our processes? Because we noticed some teams will call mobile crisis immediately, I know this is all patient dependent as well. So there will always be some variations depending on how the patient presents to you. But there are times internally we discovered that the same process isn't followed. So we've developed checklists, and we're talking to each other about how we can align some of our practices, and then even amongst our ED providers, if we had some alignment there. So our nursing team always kind of knows what to expect and what to do and how to start the process. And there are some cases that are very simple and they're here a very short time, placement's easy to find, and there are others that there are extenuating circumstances with, and that's the group that we tend to have more fluctuation with and more inconsistencies. And really what we're hoping to get is to a point where, and certainly we had patient complaints also that drove some of this. The families are like, well, we can't just sit here for 36 hours. So what can we provide safely for the patient to do while they're waiting for placement? So that's been a big item and a big aha moment. Different things like that. So it's driven by internal incidents that have occurred, patient complaints. I would say we have multiple driving factors in this.
Nice. Just curious, is anybody else also working on mental health projects in their hospital?
Hi, this is Jody from Adelia Health. We just finished our community health needs assessment, and mental health was one of the top concerns of the community. So we will be doing something, but we will be discussing our implementation strategy in the next couple of months.
Perfect. So then this will be an opportunity again with Tammy and Jody to potentially connect in the future. So this is another goal for the call, is to get you all to network with each other and say, oh yeah, I heard Tammy talking about it. And
I took some notes.
Yeah, we're in the middle of our community health needs assessment as well, and absolutely is a high need item.
On our last call, there were a few people who chatted in about the sepsis work that their hospital was working on. So I don't know if who that was, or if you're on today and you wanted to share about that. And I would just invite you, Jody and Tammy, as you're working on your project. Again, if there are tools that come out of that, it's, I would just invite you to like share and kind of let us know kind of what worked for you, what didn't work for you as you learn from your implementation. Would anybody else like to share about their QI activities?
This is Jody from Adelia Health again. I'll just share, I'm not in particular to MBQIP necessarily, because what I find with those reports is a lot of our numbers are so small that there is not reportable data. So I don't usually get a lot of good information from the majority of those reports. But we got a new CEO this past fall, and he is a quality person. So he is teaching me a ton and has brought in a whole new methodology, I guess, that we were not used to, and how we're approaching performance improvement. So we have bright idea boards, we've got A3 projects and key performance indicators, and all of it is tied to the 5 pillars of our strategic plan. So currently, every department has to have an A3 project in patient and family experience. And then there's an A3 team that I'm on that team, and we round on every department and offer advice, see how they're coming with their A3 projects. So we are all in the very much learning of all of that. And probably for the first time, I feel very supported in performance improvement, whereas before it was always, well, if we get time, we'll get to that, where now it's become more of a priority. So personally, I'm excited about that. Everybody else, maybe not so much, but it's been good for me.
Nice. Thank you for sharing, Jody. That's always a good story to hear when QI becomes priority, and also the support of the staff. That's really fantastic. So there was some discussion on the ED throughput and just also, yeah, wanting to kind of understand more. I feel like that kind of came on top. There was one of the OP measures. If I just go back really quick to the graph. So ED throughput measure OP18. And so how is that going for people? It sounds like that was, one of the priority ones. Anybody working on that one? Okay. So one thing that we want to do as we think about the project, well, this MBQIP work for next year is how can we have, well, data reporting is going to be the number one. We do want to improve those data reporting rates. That's really the big goal of the project. But then the second goal of the project is looking at the QI activities and actually then improving outcomes. And it could be, and it is, around the work that you're doing. Most of it is centered around the core MBQIP, but it could be also around other work that's a priority for your hospital. So it's like, how do we then also raise the outcomes? So we do want to have kind of facilitate more of that discussion when the project year starts again in September. Is what are again the tools, what are people implementing, what are the lessons being learned? And so just start thinking about that now and kind of what you would like to share with the group or what you would like to ask the group. So this is not just sharing and showcasing, it's also asking others, how are others, what advice they have, how they would handle something that you're working on now, and just kind of trying to get ideas from each other. So that will be one goal for next year. And yeah. So is there anything else that people would like to ask, comment? And again, this could be anything, not just the QI activities, but it could be data reporting, data submission, data abstraction trainings coming up. Just anything else that people would like to comment on. All right, so we will have another call in August. Agenda to be determined, but probably along again the same lines, QI, data reporting. We will see, but we will keep in touch. So we will see you then again in 2 months. But again, thank you so much for being on the call today and for sharing about the amazing work that you're doing. And again, our mentors, Tammy and Karen on the call for sharing what you're doing as part of the program, and exciting work. So go Minnesota CAHs. We will see you again in August. Bye-bye, everybody.